Welcome to Future Talk. On today's program, we're going to look at a virtual hospital where real doctors can expand their medical training by working on virtual patients. It's called CliniSpace, and its goal is to train medical personnel to act quickly and accurately in high-pressure situations such as mass casualty incidents. CliniSpace won the 2011 grand prize of $25,000 at the Federal Virtual Worlds Challenge sponsored by the U.S. Army Research Lab. In a few minutes, we'll have a demonstration of CliniSpace, but I'd now like to introduce my guests who are the co-creators of CliniSpace, Dr. LeRoy Heinrichs and Parvati Dev. LeRoy Heinrichs, MD, PhD, is co-founder and executive medical director of Innovation in Learning, which is a company that develops learning technologies for the healthcare market. He's also professor emeritus and former department chair of obstetrics and gynecology at Stanford Medical Center, and he also spent several years developing computerized 3D models of human anatomy. Parvati Dev, PhD, is co-founder and CEO of Innovation in Learning. She was also the founder of Summit Labs at Stanford University, which is an internationally recognized learning technologies lab that did pioneering work using computer technology for medical education. She also developed the first commercially available 3D imaging system for surgical planning. Dr. Heinrichs, exactly what sort of things do medical people learn in CliniSpace? What's the main strength of this product?
People come to CliniSpace to have experiences in an immersive environment that's much like a real place, like an emergency department or another hospital bed room, and to take care of patients that respond as they would expect them to do in real life.
So they practice here before they go out to real patients?
It is a way of learning, having experiences, preparing them for seeing real patients, and it's a place where they can fail safely without harming anyone.
Now, Parvati, I understand that CliniSpace recently won a pretty important prize. What can you tell us about that?
We were very excited about it. We won the Federal Virtual World Challenge Prize, and this is organized by the U.S. Army Research Labs. And we won it for two things. One was for the artificial intelligence that we have in CliniSpace, in the objects, in the patients, and then the grand prize over all the categories.
Now, does the fact that this is sponsored by the U.S. Army indicate that this might have a lot of application in a military setting?
Absolutely. While we began with what you would call civilian settings, we have found that the military is very interested. So we are actually talking with some branches of the military about modifying it for the Army medic in the field, for the Air Force medic who's doing the evacuation. It's really quite interesting what can be done.
So Dr. Heinrichs, is there still a lot of development to go with this product? I've seen demonstrations of it. It seems like the sort of thing that could just keep growing indefinitely.
You have captured it correctly. It's a beginning product, and we're focusing on things for nurses at this time, and we're also reaching out to more and different kinds of physicians and pre-professionals as well.
Now, I understand that you have a short movie on the computer here, which will give a little background. Why don't we go ahead and see that film, and then we'll talk some more.
Okay, let me begin it, and here it is, and I will start it now. And so Adiana is a company, a sales company with whom we've worked, and CliniSpace is our place. Here is one of the rooms going into a supply cabinet, and we'll show you things very quickly here to show how you, as a facilitator, can set things up. Everything is interactive. Even the PowerPoint on the wall that you see can be played. You can enter the space quickly because it's browser-based and not requiring a heavy-duty computer. Here's an example room, still another room. You can choose the avatar that you want to look like today. and you want for the role that you've been assigned.
So you create your own character, your own doctor or nurse.
That's correct. And so the instructor might ask you as a physician to play the nurse today, and that will give you a perspective. Here's the electronic medical record, a high-level requirement in medicine these days, and a chance to learn it. Here you see a patient with a wall monitor and their vital signs showing. You see, in this environment you can have two separate patients and you do things with them. Here is illustrated somebody doing a CPR. So this is a movie with a lot of clips from different kinds of patients, and these can be of one of several types. Here is a display of what the urine output was for that patient. Here is a demonstration of the vital signs, and we will talk about that medical model in a few minutes. Here's illustrated how you would transfer knowledge into a chart, and for coders to learn to use. And so it serves multiple users. Here is part of what we call the back end, where you record data. This is about cardiac arrhythmias and the kinds of common conditions that physicians see and must prepare to see in the hospital. So these patients are dynamic, and the objects in the world are dynamic. And so for these reasons, it's one, the artificial intelligence. It's a number of smart objects, and the patients behave correctly.
Now, is it pretty robust, so everything in this virtual emergency room would be in a real emergency room and vice versa, so it's a full setup?
Yes, not only for emergency, but also for other kinds of medical conditions. You've earlier mentioned about mass casualties. We can have a lot of folks coming in and swamping the emergency department. Here we're illustrated too. And we could also have a neonatal, a baby that must be resuscitated. And so it has multiple levels.
Can it be customized so that the users can create their own patients, or do you create all the patients?
Oh, we expect people to create their own patients from the scenarios that they've already developed, and in that way they apply the curriculum that's important to them and the scenarios, and so we don't want to reinvent the wheel, but this is a tool that many people can use.
We actually have the ability to let a person set up an initial state of a patient and then some triggers and milestones. So if the learner does the right things, then the patient moves to a new state that is in a better situation or to a worse situation.
So you want a clock here, whereas if you don't do anything, the patient just dies?
Yes, absolutely. If you don't, in our trauma case, if you don't do something within the first 3 minutes, if we set it for serious, then within 3 minutes, that blood pressure is going to plummet downwards.
I would imagine, though, that you could pause it if you want, maybe even back up and do it again.
We can pause it, we can restart it.
Something
yes.
you can't do in the real world.
That is absolutely true.
Okay. Have you gotten any feedback from anybody? Has anybody said, you know, I used this and I was a better doctor as a result, I felt more confidence in the real situation?
LeRoy?
Yes, we've done a number of studies with a number of virtual worlds, and a recent one that we had some 22 doctors and nurses from Stanford and San Mateo County who were in world, and they said, my, oh my, what we have learned here that we didn't know. One physician said, I could feel my blood pressure going up as the patient's blood pressure was going down. They really identify with what's going on in this virtual environment.
And in fact, in the mass casualty situation, they really felt that their confidence in their ability to deal with a large number of patients simultaneously had improved through using the program.
So this is basically helping your reactions. I mean, it's not the hands-on thing. It doesn't teach you how to wield the scalpel, but it teaches you to think and respond quickly.
Yep.
It teaches you about this loop of making observations in a clinical environment and thinking about now what next needs to be done and taking that action and then reflecting on it. And so it's the observation, the and then finally the reflection that allows you to go through the process again and again and again.
Now I understand that you have an actual demonstration you're going to show us where you're going to be the physician and Parvati, you're going to be the nurse. So let's go ahead and see what a live session looks like.